Today, we're delving into a topic of utmost importance: our kidneys. These vital organs play a crucial role in maintaining our overall health, and understanding their function is essential for our well-being. The kidneys, shaped like beans and located just below the rib cage, are incredible multitaskers. Their primary function is to filter blood, removing waste and excess fluids to produce urine. But that's not all. Kidneys also help regulate blood pressure, balance electrolytes, and support the production of red blood cells. In essence, they act as the body's natural filtration system. However, despite their remarkable abilities, kidneys are susceptible to damage, and one common consequence is chronic kidney disease, CKD. CKD is a condition where the kidneys gradually lose their function over time. If not addressed, it can lead to serious health complications. Many bad habits can also damage the kidneys over time and increase your risk for CKD or make existing CKD worse. Detecting and treating kidney damage early is crucial to prevent progression to kidney failure. So in the rest of this video, we'll cover 15 bad habits that can harm your kidneys and steps you can take to avoid kidney damage. Number 1. Drinking too much soda or soft drinks. Sugary sodas have no nutritional value and contain phosphoric acid that can erode kidney health over time. Just 1 to 2 cans a day is linked to faster kidney function decline in several studies. Switch to water or unsweetened teas instead for your health. Number 2. Overusing pain relievers. Over-the-counter pain meds like ibuprofen and naproxen are usually safe in small doses now and then, but frequent or long-term high-dose usage can damage kidneys over time. Use the lowest effective dose, take with food, and avoid mixing meds. Number 3. Not staying hydrated. Dehydration causes waste and toxins to concentrate in the blood, overworking the kidneys. Adults should aim for 3.7 liters of fluids daily. If you sweat heavily or live in hot climates, you may need more. Pay attention to thirst and drink plenty of water throughout your day. Number 4. Too much protein. Your body needs protein to function, but too much can strain the kidneys. Limit high-protein foods like meat, eggs, and dairy to 0.8, 1 gram per kilogram of body weight daily. Spread intake over meals instead of one large dose. Number 5. Too much sodium. Salt causes fluid retention in those with unhealthy kidneys, leading to swelling and hypertension. Limit daily sodium intake to 1,500 to 2,300 milligrams. Avoid packaged foods high in sodium. Don't salt your meals before tasting first. Consider potassium salt substitutes. Number 6. Smoking tobacco. Smoking slows blood flow to the kidneys, reduces their ability to filter blood, and causes DNA damage in kidney cells. Smoking just 2 packs daily doubles the risk for CKD. If you smoke, quitting is one of the best things you can do for your overall and kidney health. Number 7. Not managing diabetes. Uncontrolled blood sugar levels damage the small blood vessels in the kidneys that filter waste, causing stenosis and sclerosis. This raises pressure inside the kidneys and impairs their function over time. If you have diabetes, strictly managing blood sugars is key. Number 8. Not controlling blood pressure. Unhealthy blood pressure requires the heart to pump harder to move blood through narrowed vessels. This excess pressure damages and weakens the kidneys' blood filters so they cannot properly remove wastes. Hypertension accounts for up to 25% of ESRD cases. Number 9. Not getting treatment for kidney stones. Kidney stones usually pass on their own, but some may require surgery if too large. Leaving stones untreated can damage kidney tissue, create urine flow problems, and lead to recurrent infections or sepsis. See a doctor for pain management, monitoring, and treatment guidance. Number 10. Not treating urinary tract infections. Bacteria like E. coli can infect the bladder, ureters, or kidneys, causing inflammation and scarring over time. Left untreated, a kidney infection can permanently damage kidney structures and function. Take antibiotics as directed and let your doctor know if symptoms don't improve in 3 days. Number 11. Yo-yo dieting. The weight fluctuations of fad crash diets cause structural kidney damage and impairment comparable to diabetes and aging. Kidneys require a constant blood flow to function properly. Rapid weight changes negatively impact this. Lose weight slowly with healthy, sustainable changes instead with your doctor's guidance. Number 12. Not getting enough sleep. Chronic sleep deprivation causes inflammation, hormonal changes, and higher blood pressure, all damaging to the kidneys. Adults should get 7-9 hours nightly so the kidneys have time to repair any daily damage. Prioritize sleep for kidney health. Number 13. Not managing heartburn or reflux. When stomach acid leaks upwards regularly, it can cause scarring in the kidneys. Over time, this can lower their function. See a doctor if you often have burning pain behind the breastbone after meals. Medication and diet changes can treat reflux to prevent kidney damage. Number 14. Binge drinking alcohol. Consuming more than 4 drinks at once makes it harder for the kidneys to keep up with filtering the byproducts out of your blood. Over years, repeat alcohol binges contribute to kidney function decline. Have no more than 1 drink daily if you have CKD. Number 15. Ignoring mental health. Chronic untreated depression and anxiety cause inflammation and higher cortisol levels, which impair kidney function. Managing mental health protects your kidneys. Connect with a counselor, try relaxation techniques, get good sleep, exercise, and eat nutritious foods. In addition to the 15 damaging habits we just covered, there are also many foods that can tax your kidneys over time when eaten in excess. Here's what to watch out for. 1. Phosphorus-rich foods. Phosphorus works with calcium for bone health, but unhealthy kidneys cannot remove excess phosphorus from the blood. This causes bone damage over time. Limit phosphorus-rich foods like dark soda, processed snacks, dairy, and nut seeds if you have CKD. 2. Potassium-rich foods. Abnormal potassium levels disturb heart rhythms and muscle function. Advanced CKD means uncontrolled potassium levels, so doctors limit potassium foods like bananas, potatoes, tomatoes, and dried fruit. Follow your care team's advice. 3. Protein-rich foods. Too much protein creates waste that overworks the kidneys. Limit high-protein animal foods like beef, chicken, pork, and fish to a fist-sized portion once a day. Have eggs, dairy, and plant proteins like beans and lentils less often if you have CKD. 4. Canned frozen veggies. The sodium and potassium content of canned and frozen vegetables makes them less ideal for those with kidney disease. Eat fresh or low-sodium canned veggies instead and thoroughly rinse canned options before cooking. 5. Pickled, cured foods. The high sodium levels in pickles, olives, cured meats, and sauerkraut are tough for weak kidneys to process. Limit servings of these foods or avoid entirely if you have advanced CKD. Or you can watch my other videos about 20 worst foods to avoid if you have kidney problem. As we've covered today, the kidneys perform essential regulatory and body cleansing jobs. When their function becomes chronically impaired from high blood pressure, diabetes, or bad habits, waste and excess fluid build up to dangerous levels. Catching chronic kidney disease early and making sustainable lifestyle changes can preserve kidney health longer to delay or prevent kidney failure. If you have any kidney disease risk factors like hypertension, diabetes, or a family history, make sure you get annual checkups. Simple urine and blood tests can estimate filtration rate and detect early problems before major damage occurs. Treatment is based on the stage of CKD and cause and focuses on slowing disease progression and managing complications. Steps like controlling blood sugar and blood pressure, changing your diet, and avoiding kidney toxins helps preserve function longer. When kidney function declines to 15% or less, dialysis or transplant is needed to replace the kidney's filtering work and sustain life. Both options have significant lifestyle impacts for patients. That's why early detection and sustainable health habits are so critical. In this video, we covered 15 detrimental habits that contribute to loss of kidney function like dehydration, overusing NSAIDs, eating too much sodium, and inadequate sleep. By quitting smoking, staying active, limiting alcohol, and managing conditions like diabetes, you have the power to steer kidney health in a positive direction. We also talked about kidney-taxing foods to limit like phosphorus-rich soda and snacks, potassium-heavy picks like bananas and chocolate, and salty items that cause fluid retention. Work with a renal dietitian to personalize your nutrition plan based on lab work and current kidney status. Small daily choices to avoid damage and promote self-care truly do add up over the years to impact kidney health and function. Our kidneys do vital work without our awareness or conscious effort, so it's up to us to deliberately make choices that preserve their abilities for decades to come. In the journey to kidney health, education is a powerful tool. Share this information with your friends and family to raise awareness about the habits that can negatively impact kidneys. Together, we can create a community committed to kidney health and overall well-being. Thanks for watching, and we'll see you in the next video.